A young man lays in pain in one of the emergency rooms at the Bangui Community Hospital. He has just been shot on the thigh after a minor confrontation with some elements of the Seleka rebels. Inside the hospital wards, the situation is heartbreaking. Tens of people are fighting for their lives after sustaining serious injuries. Many are said to have been shot in various areas across the country by people believed to be rebels. But there is a much bigger problem. Since the rebels toppled the former government, hospitals have slowly been running out of medical supplies as the numbers of patients admitted in hospitals continue to go up. Many hospital personnel have either fled to neighboring countries or just chose to stay home for fear of the security situation. Death is now a common phenomenon in many hospitals.
I'm talking to you. I lost my daughter 5 days ago. I was at the hospital at the mortuary. So in 10 minutes, 15 cops was brought to that place. That means there is a real problem. In a country where people dead like animals, this is a problem.
Many specialized machines in this hospital are now not working anymore. The pharmacy now has just basic drugs left, which patients have to pay for. Electricity supply has been disrupted and management forced to use alternative generators for power. Managers say were it not that it is a community hospital and the only one around, they may have been forced to close down long time ago.
Donc le gouvernement doit pouvoir faire pour pouvoir.
We appeal to the government to look into this issue, give us equipment and medicine so that other hospitals can start operations and help the people.
Même problème que l'hôpital communautaire.
Road accidents have shot up since the rebels arrived in town. This has been attributed to their reckless driving in the city. But perhaps the most troubling issue to hospital staff is the pressure they get from the rebels. When one of their own falls sick, business literally comes to a standstill in the hospital. They demand that they be treated first as other patients wait.
Surtout relevant des Seleka qui étaient rentrés.
The situation was made worse when Seleka came in. Many of them don't know how to drive.
Donc ils roulaient trop à vive allure.
We have been getting many accident victims and that has strained our facilities. This is an issue of great concern to us.
Beaucoup d'accidents, ce qui fait que ça aussi, ça a constitué.
However, things have started to change slowly in the recent past. Several non-governmental organizations have started partnering with the institution, trying to improve service delivery. But it may take some time before things get back to normal. It's a big challenge for doctors and hospital staff here. The number of the injured, especially those with bullet wounds, has been on the rise, especially since the rebels took over control of the city. However, supplies are running out first. Kofa Mrenje, CCTV, Bangui, in the Central African Republic.